In terms of treatment and post-treatment, a diagnosis of bowel cancer is very challenging, but our guest went through a lot to overcome such a diagnosis. He is Pete Hill of WARE, Ware, United Kingdom. This is the Cancer Interviews podcast, and I'm your host, Bruce Morton. So now, here he is. Let's hear his story. And Pete, welcome to Cancer Interviews.
Thank you, Bruce. It's an absolute pleasure to be here with you.
And we look forward to hearing your story. Now, the first thing we want to do, we want to start out the way we always start out with a guest, and that's to learn a little bit more about the guest's life outside of cancer. So if you would, tell us a bit about where you're from, what you do for work when you're working, and when time allows for fun, what you do for fun.
Yeah, absolutely, Bruce. Well, I'm in Ware, Hertfordshire, as you said, which is about 30 miles north of London. I'm a London lad. I was born in North London, but moved out here to Hertfordshire many years ago when I got married. My career for many years was in public health. But when I stopped that, I then took up a 2-year contract with the Alzheimer Society here in the UK. That ended in 2018, and since then I've been very fortunate to be, I suppose people call it a gentleman of leisure. That's what my friends call it, but it's not, it doesn't quite work out that way. And these days I've found myself into the world of being a radio host. So I host the D Word on an internet station called UK Health Radio, which is the UK's only weekly radio show which has dementia as its topic. As well as that, I've got a music show which I just started, playing some Americana music, which goes out on a couple of the stations. And I do commentaries on local soccer matches around here in Hertfordshire. So I should say life is never dull, Bruce, never dull.
And do you have a favorite football team?
Yeah, I have a favourite football team, which has been handed down through the family. Came from my grandfather, who was a season to get older at Arsenal. And so I've just had to follow it, and I've been following them ever since.
Now let's talk about your cancer journey. For each of us who is a cancer survivor, it's not like we were born with cancer. We were going along through life and we thought our health was in pretty good shape. And then something happened that seemed less than normal, something other than normal. And that triggered a chain of events that ultimately resulted in a diagnosis of cancer. So for you, what was that item that triggered this chain of events?
Well, it was strange, really, Bruce, because it was back in November 2021, and I had COVID for the only time in my life. And after it, I didn't really feel right. And we went on into 2022, and I just didn't think I was feeling as I should. I thought I might have been recovering from COVID or something else going on. And then I started to get, my bowel habits became irregular. I don't know, you just know that there's something going on. Couldn't quite put my finger on it. And I then had some blood in my stools, which is a pretty good sign of bowel cancer, as I've found out. And it kind of triggered from there. But the initial thing was this real feeling in my body that, hey, something's not right here.
And at some point, I suspect you needed to be seen by a healthcare professional.
Yeah, I then went, got seen by a GP, local doctor here in the UK. From the GPs, I went to a specialist. We had some tests taken, and the clincher was a colonoscopy. And when I had a colonoscopy, I was diagnosed with cancer in my lower bowel, and it was the 22nd of April 2022. It seems strange, the kind of the dates you remember, but I guess that's a biggie, and one you always will remember.
By the way, we're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or review below, and share it with your friends. Kindly click on the subscribe button below and click on the bell icon. That way you'll be notified the next time we release an interview. And if you or a loved one are facing a cancer diagnosis, please click on the link in the description and show notes below to check out our free guide, The Top 10 Things I Wish I Knew When I First Got Cancer. Now, Pete, let's talk about when you first got cancer. You were diagnosed, and part of that diagnosis was learning that you would have to have a stoma bag. How difficult was that news?
Yeah, it was, from the initial diagnosis, I was referred to a surgeon. I went for my first meeting with the surgeon who, drew me a diagram of where the issue was, told me exactly what he was going to do. And he said to me, because of where your tumor is, there is a likelihood when we rejoin things together, there might be a leak. And if there is, then, this could be a big issue and something you don't really want. So if we give you a temporary stoma bag, we will reduce the possibilities of that happening greatly. And so I guess, given that choice at that point, you're thinking, well, I don't want anything else to go wrong here. So let's go for that option. So that's the option I did go for. I had the operation again, another date I remember very well, the 10th of June 2022, and woke up with a stoma bag, which was a whole new deal. There was kind of a double whammy because you're hit with the diagnosis of cancer, which is one thing that you're trying to get around, and the other thing you're trying to get around is, what is this thing? Because, to be honest, I was totally ignorant. I had no idea about stoma. I'd never come into contact with a stoma bag. Didn't know anything about it. Didn't really know much about the process or anything. And so that was a massive learning curve, and one that probably, to be honest with you, I found a lot more difficult than overcoming the cancer diagnosis.
That said, I have to share with you, Pete, that in my experience of doing these interviews and speaking with people who have had to have a stoma bag, their experiences vary widely in terms of the amount of assistance they got early on. There were some who had nurses who were very attentive about making sure that the patient could manage their stoma bag once they were out of the healthcare facility and on their own. And there were other healthcare facilities in which the nurses were not helpful at all. And that made an already difficult situation more difficult. To what degree did you get assistance in those early days with the bag?
No, there was no problem with the assistance, Bruce. The assistance was superb. I had a marvellous stoma nurse called May, and the way May termed it, as I was in the hospital, and she said, "I'm going to be really frank with you here. You're not going to get out of here until you learn to manage that thing." And so that's a pretty good incentive to learn how to do it. And the actual mechanics wasn't an issue. I mean, the mechanics and, changing the thing and all of this, it was the psychology that was the problem, and also the fact that you have to change your diet. Suddenly there became a whole raft of things you can't eat and a whole raft of things you could eat, a lot of which were things that I didn't really want to eat. So my whole diet had changed. And the other thing was fluid balance. So you can't drink too much, but if you drink too little, then you might have a problem in terms of kidney function. And psychologically, those were the bits that I really struggled with. And recovering from the operation as well, okay, I struggled with that. But psychologically, it was the stoma bag I felt at the time was holding me back. What happened was the NHS here in the UK provided me with a lovely stoma nurse, Alison, who came and visited me, and we chatted, and she, tried to get me through the process. Through that process, I unfortunately ended up back in the hospital again because the stoma bag was malfunctioning a little bit. I think there was a blockage and a problem. And I had three kind of light bulb moments that I called them through this whole process. And one of those occurred in a hospital when I'd gone in and I was feeling pretty down, and my stoma bag was very fluid and I couldn't control what was going out, and you're feeling a little bit down about it. And I had words from a doctor, and he said to me, exactly what he said to me was, always remember, you're in control of this thing. We will do our best, but we're only here to support you. And suddenly my whole mindset changed. And I thought, wait a minute, this bag is ruling my life. So I'm going to take a bit of control. And coming off the back of that, I came home and my stoma nurse, Alison, had said to me, look, I know you've been struggling with this, so do you fancy some counselling? She said, I can get you 6 counselling sessions. It's absolutely free with a really experienced counsellor. And at the time I thought, hey, let's go for it. Why not? So I did. Leslie was my counsellor. She was absolutely marvellous. She'd worked with cancer patients for 25 years, very experienced. And we had 6 Zoom sessions for an hour. A lot of which, I've got to say, was talking about families and laughing and putting the world to rights and various other things. But the one thing she said to me, which was number 2 light bulb moment, was, do you realise that when you've gone through all this, you will never be the same person? Now, when you first hear that, you get a bit depressed. You think, wait a minute. Oh, no, I'm never going to be the same person. But she gave it a perfect pause when she came back. And the next part of the sentence was, but you could come out of this the new improved model. And I joked, hey, Pete Mark 2. And suddenly that one, along with the doctor who said we're here to support you, turned my whole mindset around. Because I thought, yeah, I could come out of this, couldn't I? And maybe there were bits of the old one that I want to leave behind. And I can come out of this the new improved model. And probably from then on, that was when I considered I really started recovering.
Now, let's talk about the procedure that accompanied your being attached to the stoma bag. And that's a surgical procedure. And describe just what that entailed.
Yeah, the surgical procedure, first of all, is removal of the tumour, which is a straight surgical procedure of, removing of the tumour and some of the tissue around it. What happens with a stoma bag, it's kind of like having I suppose you in the States would call it a detour. Here in the UK, we call it a diversion. In that, obviously, things normally take their natural course. They go through your intestines and they come out through your lower bowel. Well, what happens when you have a stoma bag is you have part of that process blocked off. So part of the area is not used anymore, and your waste products flow out through a stoma bag, which is a small bag which is attached to you by virtue of a stoma, which is something that's created from your intestine. It's a bit scary at the beginning because you're looking and there is literally a piece of your intestine there coming out of your stomach area. But you soon get used to that, and you get used to attaching the bag and changing it and all those things. So that kind of was the procedure. And I guess we'll be going on a minute into, what you have to do to reverse that whole procedure.
This procedure that you underwent, part of it involved chemotherapy. If you look back on the chemotherapy piece of the whole equation here, what was the toughest part?
Yeah, I mean, the chemotherapy came about when I had the initial procedure, so I had the initial operation, and obviously what happens then is, in terms of cancer surgery, they look at lymph nodes around where the tumour's been removed to see if there's been any signs of spread, and those lymph nodes have been affected. I went back to see my surgeon, I think it was about a month after I'd had the operation, and he said to me, look, there's really good news here. We've taken out 24 lymph nodes and we can find absolutely nothing. So that's really good. He said, but we have found some cancer cells in blood vessels surrounding where the tumour was. I think it would be good if you saw an oncologist. So I went to see Dr. Dan Krell, who's my oncologist, lovely guy. And Dan's take on it was, look, you could walk out my office now with an 85% possibility that this won't come back. And he said, I wouldn't blame you for doing that at all if you wanted to. But if you want to take a course of what he called mop-up chemo in tablet form, I can take that to over 90%. So you're kind of left again with another one of these decisions that, okay, 85%, that's pretty good. But you're thinking, and I thought at the time, well, actually, I owe it to all my friends who were brilliant in supporting me and my family who were brilliant in supporting me to have the maximum possibility of this not coming back. So I said, okay, we'll go through the chemo. We went through 8 rounds of chemo, which was delivered by tablets. And I've got to be honest with you, at the beginning, when you start chemo, you think horrible things like hair's going to drop out, I'm going to be sick and all this stuff. I didn't have any of that at all. The main thing was, because I had a stoma bag, it was actually balancing the chemo with the stoma bag. And that's really where some of the issues occurred. But I felt I didn't have that much energy. I had kind of strange things. My nails split a little bit. And I had some really, really vivid, strange dreams, which I've talked to people now that have gone through chemo, and they said, oh, yeah, we had those as well. At the time, didn't realise it. But, like I said, Bruce, I've got to be honest, I was really lucky. And I breezed through almost the sessions of chemo. The only thing I found difficult really was taking all the pills, because I was taking 10 pills a day, plus also further medication which was related to the stoma. So, there I was kind of popping 15 to 20 pills a day for someone who's gone through his life not really wishing to take tablets at all. My wife criticises me because I don't want to take a tablet when I've got a headache. Taking 20 pills a day was a bit interesting.
Now, Pete, I'm guessing that there had to be a juncture in which you sensed things were getting better, that you were moving toward recovery, moving toward survivorship. Could you describe what that was like?
Yeah, I mean, I've already mentioned the 2 light bulb moments when the doctor said what they said, and also I had the counselling. And number 3 came when here in the UK we've got a cancer charity called Macmillan, who are brilliant. Excellent cancer charity, and they offered me what was called a HOPE course, and it was a 6-week course which covered every aspect really. It covered the physical things that you've gone through, financial support, psychological support, and the whole lot. And I thought, yeah, why not? Let's go for it. And I stood outside a room which contained 12 people who I'd never seen before in my life. You're always a bit apprehensive. I'm going into this room full of 12 people. I've never met them before. And I went into the room and I suddenly realised that we all had this unconscious bond between us, because we had all gone through a similar process. Now, they hadn't all got the same form of cancer as me. There were ladies there with breast cancer, people with Hodgkin's lymphoma and various other things. But we had this kind of cancer thing that joined us all together. And within 10 minutes, we were chatting away like we'd known each other for years. And that probably, when I walked out of there, that was the time that I suddenly thought, wait a minute, I think I'm going on the right road here. Because up until that point, you obviously get assurance from medical professionals, which is great or whatever. But when you actually see people that are going through what you're going through and you compare where you are, you do realise that suddenly, this is where I am. I think I'm starting to recover. And the great story about that group is that group has continued. And I now have 5 really good friends out of that group. We've got our own WhatsApp group. We talk to each other every week. We meet up. We're actually meeting not too far, we meet up, and it's been we have this saying that we didn't want to be members of the C Club, as we call it, the Cancer Club, but as it's now come upon us, we are going to make the most of it. And one really good thing that's come out of this is our friendship, which has been a real positive.
Pete, I want to clear something up. I I thought you mentioned you included the operative word temporary when you initially referred to the stoma bag. Is that temporary? Has it been, is the stoma bag no longer a part of your life, or is it still there but won't be there for long?
No, it's gone, Bruce. One of the strange things that my stoma nurse Alison said to me right at the beginning was, you should name your stoma bag. Because people do name their stoma bags to take a bit of the mystique out of it. So my stoma bag was called Cliff. And Cliff, to be honest, he gained a personality of his own. I often felt that people were more interested in him than me on occasions because my friends took him in as being a separate entity, as almost, a separate little being. And when it came to the time that I had a reversal, which was the removal of Cliff, what initially happened was when I had my operation, had I not had the chemo, then I would have had a reversal within 3 months. Because I had the chemo, it delayed it, and the reversal came within 11 months. And so this was May 2023 when the reversal occurred. And Cliff was no more. Away he went. A lot of my friends, I had messages the day that I had the operation saying goodbye to him before they said, "How are you?" which was interesting. But I had a reversal operation, and, as I described at the beginning, it was like putting the detour in your lower intestine. Well, the detour signs were removed, and suddenly everything was back as it was. That in itself becomes an issue because your body has been operating in a different manner for 11 months, and suddenly it's back to operating how it had done for all the years before. And that's something which I'm still getting used to in terms of time, because I found out about something called lower anterior resection syndrome, which is called LARS. And this is something that people that have a reversal operation, having had a stoma bag, can suffer from in various degrees. There is a brilliant Facebook group. If anybody is in that position, then please do look at the LARS Facebook group, because there are people all over the world that are going through the same thing, and there's a tremendous amount of support up there. And the one difficulty in terms of the reversal was when you have the initial stoma bag, you're given the diet, can't eat this, can eat that. And suddenly that diet is changed by completely turned on its head. Because suddenly all the things you should eat during your stoma journey are things that you don't really want to eat now. And all the things you couldn't eat are things you can eat now. So and I'm still learning. I'm a way on from having the reversal, but I am still learning what you can eat and what you can't. And one of the really strange things is things that you didn't like before the stoma reversal maybe things that you do like now, and likewise the other way around as well, which is it's a kind of strange way of getting used to it. We have a spread in this country called Marmite, which I wasn't particularly fond of before I had all this going on. Now I think it's great. So it's you get an added bonus if your diet changes quite drastically as your body not only heals from the operation, but obviously heals from having itself put back to in working order that it understands, I suppose, if I can put it that way.
Pete, I'm curious as to, in addition to the ongoing process of regulating your diet, for lack of a better word, if you were, from a health standpoint, 100% pre-diagnosis, if you could quantify it now, these days, how close are you to 100%? And if you fall short of 100%, in addition to regulating your diet, what are other things you cannot do?
It's interesting. Really good question, Bruce, because I had a consultation with my oncologist very recently, And he asked me that exact question. And I said to him, well, look, I think I'm about 80% back now to where I was. I'm living life as I was, I explained at the beginning of our conversation, all the things I'm doing. I'm back doing all of that. A lot of that took a real hit during the time when I was recovering, and now I'm capable of doing that. The regulating diet thing, I think, has caused some issues because I'm very confident about cooking at home and eating at home, but I'm still not that confident about eating out. I have started. And there are certain places that I can go to now. But that's the next big one for me, I think, in terms of getting back into 100% where I was. And also going out in the evening, going to the cinema, those kind of things. These are the kind of things I'm now working towards. I think my health, as I say, is about 80%. I've got a dog. I take the dog for walks of, a couple of miles and not a problem. So all those things have come back. And I think some of it's still psychology. I think there's still a lot of psychology in what I've gone through. I'm also about to kind of break another one, not too distant future. I'm going away to Amsterdam for 4 days for a city break. And again, that hopefully will be overcoming a bit of a psychological hurdle as well. I've gone away from home in this country, but I haven't actually gone away from outside of this country. So again, that was something that, I like to do regularly. I've got good friends in Canada, I've visited Canada regularly. I've been to the States where you are as well. So again, that's one I'd like to add to the 80%. So, there's work to be done, but I'm pretty happy with where I've got to so far.
Our guest is Pete Hill of the United Kingdom. He's a survivor of bowel cancer. And Pete, we're going to wrap up now. And just as we start off our interviews in the same way, we like to end them the same way. And I will pose to you this final question, and that is, if you were to encounter somebody who had just been diagnosed with bowel cancer and they have a lot of questions and there would be a lot of information you would want to impart to this individual, if there's one thing that stands out, one point that is uppermost that you would want to make sure that it resonated, what would it be?
It's got to go back to that first moment where that doctor stood in front of me and said, always remember you are in control. Because that psychologically is so important. You feel at the time like you've had a whole load of you've had your whole life taken away from you, and you are in control. That's what I'd say, because I think that's such an important aspect, and it was a thing that started. I had those 3 moments on my road to recovery, but that was the starter's pistol on my road to recovery.
Excellent. Pete, thanks so much. Thanks for imparting your story. And it's a story that should be of inspiration to anybody who's been diagnosed with bowel cancer, because you went through a lot and you've overcome a lot. So, Pete Hill, thanks so much for being with us on Cancer Interviews.
Thanks, Bruce. It's been a pleasure.
And that will wrap up this episode. We'll conclude the way we always do by saying that if you or a loved one are on a cancer journey, you are not alone. There are people out there like Pete Hill who have information for you that can help to ease your cancer journey. So until next time, we'll see you on down the road.